The World Health Organization estimates that each year approximately 1 million people take their own life. That's one death every 40 seconds. Experts predicted numbers would peak in 2020, but no one could have imagined the devastation brought on by COVID-19. During the coronavirus pandemic, you may experience anxiety, sadness, and loneliness. Existing mental health conditions, including severe anxiety and major depression, may worsen. If you're feeling hopeless, contemplating self-harm, or you're concerned about someone else, I'm here to tell you there is hope. A Mission for Michael is dedicated to helping clients achieve complete inner and outer transformation. Mission for Michael is the premier resource for intensive mental health treatment in Southern California. With an astonishing 2-to-1 client-to-staff ratio, each client in their facility receives individual care 24 hours a day, overseen by a team of all doctorate or master's level clinicians. With a focus on evidence-based treatment, along with personalized and compassionate care, they offer mental health treatment that can change lives. If you're suffering from mental illness or you're concerned about a loved one, go to amfmtreatment.com. Again, that's a mission for Michael, amfmtreatment.com, or call 866-581-4401. Again, that is 866-581-4401.
Real talk.
Headlines have become sickening. They become poisonous.
Dissecting headlines.
Defying state orders. Sheriff Bianco not enforcing what the governor is saying.
Dialed in with decision makers.
Clarify what you actually meant.
Get the answers you need.
At the beginning of this, we were told don't wear a mask. Is this really helping?
Expect a different kind of newscast. Fox 11 News Special Report. Weeknights at 7.
Hey everyone, it's a dose of Dr. Drew.
Here we are again. We're going to be joined today by Dr. Kelly Victory, a board-certified trauma and ER specialist, 25 years in the working in medicine. She's also alumnus of the National Preparedness Leadership Initiative, Harvard School of Public Health, Kennedy School of Government, developed meta leaders for national disaster preparedness and response. So she is well suited, and she's of course an alumni of this show. She's well suited to talk about the COVID-19 situation. Generally, everybody, good news. I mean, I'm just reviewing the data before we got in here, and everything is down. It's down wherever I look, and down to the point where I'm actually where am I here? I'm angry with California that we have these criteria to reopen that are literally never going to happen. And Dr. Kelly and I will talk about that. Why don't we get Dr. Victory and I will talk about that rather. Let's bring in Kelly Victory, why don't we? There you are. Thank you for joining us. Good to see you again.
Hey, Drew. Good to be back. Thanks for having me.
So in California, we have these criteria where in order to reopen, we have to have for several weeks, literally 1 week and then 3 weeks following that, 1 case per 100,000.
Right.
And 1 case is defined by a PCR viral particle of 1. That doesn't necessarily mean somebody's sick, doesn't mean they're infectious, doesn't mean they have COVID. We just found the viral particle around the person, which we're going to find more and more these days because the virus is amongst us. And we haven't differentiated between cases and presence of viral particles. And now here in California, we've been subjected to closure until we find 1 per 100,000 for a week, which is never going to happen.
No, Drew, it's just pure insanity. We are in the full throng of a case-demic. This is not a pandemic, it's a case-demic.
Yeah.
Because we're defining cases based, as you rightly point out, viral particles in someone's nose and mouth without any clinical significance to that.
Right.
We have no idea. Most of these people who are, quote, positive cases have nary a symptom. Some of them have mild symptoms, but 80% have no significant illness whatsoever. And there's no indication that those positive PCR tests are showing us a virus that's actually even capable of replicating or being transmitted to others.
Right. So let's dig into that a little bit. So a PCR is a polymerase chain reaction. It takes a piece of RNA and it amplifies it through 40 cycles, thousands of times. And as such, it can find just fragments of RNA and be positive. It's a very good test. But it doesn't mean live virus, doesn't mean somebody's infectious or infected or sick, doesn't mean anything. It just means the particle's around. What do we do with it? What do we do with this?
Right, which is part of the reason why, by the way, we've known out of common sense, in addition to decades of experience with previous respiratory viruses, that people who are asymptomatic
Yeah,
are generally not going to be spreading it.
usually. That's true.
Usually. The reason they're asymptomatic is because either A, they have already rendered the virus inactive. Their T cells or own antibodies have already, taken the virus and made it so that it's inactive, incapable of replicating, and incapable of causing disease in themselves or into somebody else, or because they had it so long ago, they got over it. And these are just some random viral particles that are left still in their noses and mouths that are being picked up, as you said, by this PCR test.
And this you've touched on something that causes me to bring up another topic too, which is the idea of what the herd immunity is. Now, the immune system is sort of broken down into big sort of categories, but fundamentally the very specific antiviral part is the B cell limb of the lymphocyte system that creates the antibodies. You've all heard about that. But the T cell is the other part of the lymphocyte system, and the T cells, first of all, they have a memory and they can direct the B cells. Also, they can kill cells that are infected before the virus starts replicating. They can go in and just get those cells. So there's some evidence that other coronaviruses might confer some T cell immunity on some people. Is that correct?
Yeah. No, that's absolutely correct. And in fact, the T cells are the first line of defense. So before you ever get on to the business of creating antibodies, those puzzle pieces that would fit into the proteins on the outside of a virus, before that ever happens, the very first line of defense are those B and T cells that get in there and just can render the virus inactive by themselves. And that's the thinking for why it is that children, frankly, are at such low risk. Their T cells seem to be supercharged at fighting off these viruses very, very quickly. They don't even need to go on to make antibodies. They just wipe the thing out and go on their merry way.
It's interesting to me that this T cell story is going to get more and more complicated and involved as we learn more about it. But I started thinking about how elderly patients don't get colds. They just don't get them. And I'm wondering, and then the younger you are, sort of the more exuberant the colds are, right? And I'm wondering if that's what's conferring some of this immunity on younger people, you think?
It certainly could be, or the fact that we've been exposed to some of this stuff in the past. We don't know how much crossover, Drew, there is in exposure to previous coronaviruses.
Right.
If you think about the fact that 25% of all common colds are caused by coronaviruses.
Correct.
So you're right. Previous exposures may render some element of immunity to COVID-19, and we simply don't know.
Which may be why we're seeing what seems to be a natural herd immunity of more like 20% than 60%. Now, some of that may be how we behave. There's a Nobel Prize winner named Michael Levitt that thinks some of it's because of or a lot of it's our behavior, but some of it may be this previous coronavirus exposure, T cell exuberance, lots of different things. But it doesn't look like it needs to be 60%. Do you agree with that?
I agree with that 100%. Where we've normally said even upwards of 60%, we've said, you need 90+% to have immunity, for example, to something like measles or mumps or chickenpox. It appears with COVID-19 that those numbers are really way lower for all the reasons we're talking about: previous exposures to coronaviruses, the whole T cell issue, and the fact that many, many people, children in particular, don't seem to require the development of antibodies to develop a significant and very effective immune response.
So where are you coming in on vaccines?
Well, in general, the backstory is I am extraordinarily pro-vaccine in general. And what I mean by that is, number one, for the standard vaccines that have been tried and tested, all those childhood illnesses, chickenpox, measles, mumps, polio, hepatitis, pneumococcus, things. So number one, in my mind, a vaccine needs to have been adequately tested for me to feel comfortable with it. And so all the childhood vaccines I do. Number two, we need to know that it's effective. We need to know that a vaccine creates the intended immune response in the host. And again, with those vaccines I just rattled off, we know that that's the case. Thirdly, and importantly, it needs to be what I call an HCID, a high consequence infectious disease, meaning the risk to the individual of getting that disease has to be significant enough that they want to take any risk inherent in a vaccine. So in my mind, when we come to COVID-19, number one, I do not believe there's a vaccine that has had anywhere near adequate time to be fully tested. So the safety remains at risk. And we can talk about just today, the AstraZeneca trial that was put on hold because of a bad response.
So
number
is breaking news, right? That
Yes.
just came out
Yes.
that the AstraZeneca, which is a more sort of, it's an attenuated virus, isn't it, or a protein?
They're actually using an adenovirus. This is a new platform that hasn't been used previously. So number one, there's a safety issue that I don't believe I'm not saying it will never be safe, but I don't believe that we are at that point with COVID-19 that we have any vaccine that has anywhere near the kind of time that we need to test that. Efficacy still is a question.
I get people wanting to wait at least 6 months. I get that. I may jump in a little sooner myself because I'm tired of this. I'm really just super tired of it.
Well, I guess the issue then is my third criteria, and that's the question I would pose, is that it's not, in my mind, although the virus is very real, COVID-19 is not an HCID. It's not a high consequence infectious disease in the vast majority of people, myself included.
That's true.
So I choose not, for example, I don't get an influenza shot every year, not because I think they're not safe, and not because I don't think they're effective in making having the intended immune response, but because I don't consider myself a significant enough risk. If I get flu, I'll be sick for 10 days, I'll feel lousy, and I'll miss a week of work, which isn't great, but I choose to. Now, when I turn 70 or 75, or if I had other underlying health conditions, I may feel very differently about it. So I don't criticize somebody or find fault with anyone who chooses to get them. Yeah. But in my mind, it doesn't constitute a significant enough risk for me.
So I have metabolic syndrome. I have hypertension, hypercholesterolemia. I don't have antiphospholipid, but I've definitely got the central, adipose. And I had H1N1 and nearly died. I'm convinced that I had a cytokine storm before people knew what to call it.
Wow, yeah.
And I look back on my history with viruses, and I always do really poorly. So I kind of feel like I'm in that category that ought to be paying attention.
Yeah, and I think that makes perfect sense. And that's I just think people should think about it reasonably. I am not an anti-vaxxer. Do not lump me in that category. I am pro-vaccine.
You want to be conservative. It makes perfect sense. And I that's why I worry about mandated vaccine. It's like I don't know about that for this one.
I agree.
Now, so some other stuff. One of our regular followers here, Andrew, asked, would you favor doing a PCR with 20 or 25 cycles as opposed to 40?
Well, clearly the current, whatever they're doing, 35 or 40 cycles is ridiculous because you're amplifying that RNA so much that, again, we're so far out of it. I am not a PCR expert, so I can't tell you what that number of cycles is. All I know is that right now we are using something that's ridiculous. I am really a proponent of saying, how can we call something a case when the individuals have no symptoms? The problem we've gone down to is when you start testing people who are asymptomatic, then there's perhaps no cycle number that's going to be appropriate. There are really very few other things, tuberculosis, for example, being one that we randomly test people who could conceivably spread the illness for something, but TB has a significantly different profile than COVID-19. When you're testing millions of people who have zero symptoms for something, that is pretty hard to design the right test.
Yeah, I get it. I'm of that. I understand that. There's also some breaking news right now on cytokines. Let me see here. Compared to patients with septic shock and ARDS, the COVID-19 cohort have lower levels of TNF, IL-6, and IL-8. So somebody asked on the thread to talk about what cytokines are. Cytokines are inflammatory mediators. They tell the cells where to go. They tell them where to bring inflammatory response. And some of them are pro, and sometimes they're down-regulating inflammation themselves. I think the finding that they're all depleted relative to bacterial septic shock, I'm assuming it's bacterial septic shock, is a little weird, don't you think?
I do. It doesn't really make sense to me because what
Yeah.
happens in the cytokine storm, just so people understand, is your body is attempting to launch an assault on this pathogen, whether it's a virus or a bacterium or some other. Sometimes it's just multi-trauma. Your body's saying, "Oh my gosh, I'm under attack.
Yeah.
I'm going to launch this assault in an attempt to fight back." And unfortunately, sometimes the immune system can go overboard in doing that.
Right.
It starts down this cascade then of launching all of these different factors, some of the ones you were just, rattling off. And that storm, that overreaction, if you will, of the immune system can actually cause far more problem than the pathogen, than the virus or the bacteria or whatever it was itself. It's actually the immune response that gets people into trouble, starts dumping fluid into the lungs, for example, starts the clotting cascade where people start forming blood clots all over in different organs and different blood vessels. And so it's really not the virus or the bacteria that's causing the problem. It's a very overreactive, over vigorous immune response.
And I'm looking at our chat here, Nicole, it's sort of like autoimmune, but it really isn't like autoimmune. Think of it more as it has some autoimmune properties to it, I guess, later on. Yeah.
It's hard to describe it. It's sort of the immune system gone awry because it launched too big a response.
But I think of it as a circulating response, a humoral response, but it's also an endothelial mediated thing. So it's hard. It's not really the way I think about autoimmune. It's a little different. And right. I think autoimmune is mediated by a very, very different system too.
Yes.
So have you seen this bradykinin theory? Do you think anything of that?
No, I'm not sure. Which
they're trying to. There was I think it was a New England Journal article that came out a couple of days ago that was trying to make a case that this cytokine storm is actually a bradykinin mediated phenomenon, and it just didn't fit for me at all. And I was sort of surprised to see it in an important journal.
Yeah, that's a new one on me. I hadn't read that one yet.
You look for it. It didn't.
Okay.
I'm certain bradykinins are activated or in the game somehow, but
no question.
But I don't see how they could play a central role in it. It just didn't make sense to me, especially when all these other immune mediators are going haywire.
But for example, we know that we've seen some great results in the people who have been using steroids to treat people early on, inhaled steroids or oral steroids, to decrease that overreaction, if you will, of the immune response. Some of the inhaled steroids have done very, very well in calming that down. So we know there's an immune-mediated, cytokine-mediated, maybe bradykinin-mediated response, because otherwise you wouldn't see the impact of steroids.
Styles on chat, I'm going to beg ignorance here. Does bradykinin figure in the CCL5 system? I don't know that. If that's true, the CCR5 system is involved in this for sure. So then it kind of hooks in that way. So maybe that's the mechanism. But that's a little too much for us today. I want to get into censorship and the misery that you were telling me a little bit before with the mics heated up here, what you've been going through, and it just drove me nuts to hear the story. So please share.
Yeah, well, and I'm not alone in this. I'm one of a handful of people who have been heavily, heavily censored throughout this COVID-19 response. It started for me early on because I came out with a video, which was not intended, interestingly, to even go public. It was a video that I made the request of a large evangelical church down in Texas, who was very interested in getting their people to feel comfortable going back to worshiping in person in church and getting their kids back to the private school that's associated with the church. So I made a video that really, in layman's terms, explained things about COVID-19 and why I didn't believe that schools should be closed, why children are at low risk of getting it and spreading it, why the mask mandates didn't make sense, and kind of everything in between. That video ended up going viral, as it were, and got something like 10 million hits around the world, but it unleashed sort of a storm against me personally by the censoring gods. And don't think for a minute that YouTube, Twitter, Facebook, Instagram, they are all heavily, heavily censored. So the first thing that happened, Drew, was that the video itself was removed, and I received a email from YouTube saying that I had violated the community standards of YouTube because I'd made statements that did not, quote unquote, did not support the stance of the World Health Organization.
Oh my God.
Yeah,
Crazy.
which is tantamount to saying the Communist Party of China. Truly, because the WHO, there's a reason why the United States has left the WHO.
Right.
So that's where it started. Then many others, other physicians, including Dr. Stella Emanuel, who came out speaking very proactively about hydroxychloroquine. State Senator Scott Jensen, who I think you've had on your show before, was censored. And
Scott Jensen had to make a major response to the state board because of multiple complaints for talking on the internet, essentially. And what I loved about his response is he included 190 references or something. I thought, oh, dude, way to go.
Yeah, and so I also had received multiple complaints against my medical license, which I very quickly and very successfully defended. My approach was different from Senator Jensen's in that I decided not to fight them point by point with regard to whether or not you agree with masks or agree with using hand sanitizer or you agree that hydroxychloroquine is or isn't a good treatment for COVID. But rather that, number one, just because I'm a physician, I did not leave my First Amendment rights at the door. I have a right to speak. I have a right to have an opinion, and I have a right to state those opinions publicly or otherwise. And that furthermore, I found it terrifying that people would be able to weaponize the very, very important and sacrosanct job of a medical board to take complaints that are levered against a physician for any particular thing, and to use that instead for political expediency or to weaponize and to harass someone.
It's literally, that's what Stalin did.
Yes,
right?
It's harassing, in other words, to silence a physician, to make me, to cancel me, to try to strip me of my medical license, to shut me down, to take me off Twitter, take me off YouTube, take me off Facebook, and say, you're a hack, you're a quack, and to launch all of these things. Horrible things were said about me with not a shred of evidence behind them, by the way, but saying that we need to get rid of this doctor because she's saying things that are dangerous. I'm thinking, what in the world is dangerous about intellectual dialogue about whether or not we use hydroxychloroquine? I mean, you and I are discussing right now, we don't have to agree about vaccines, or we don't have to agree about what causes a cytokine storm. I have no right to say that you must be silenced and eradicated because you and I disagree about something.
This is the nature of medical discourse.
They've tried.
All we do is we read literature, we read papers, we know it. That's all we did in medical school and residency, to learn how to study literature, and then discuss it amongst ourselves and try to arrive at the truth and best practices. That's what we do. And people who just learned how to pronounce a medication 3 weeks ago should not have an opinion about this.
No, and that's my point, is that why should somebody who has not have a medical degree, hasn't gone to medical school, has never taken a COVID patient, has not put a stethoscope on somebody's chest ever, or in the last 40 years, why should that person be able to say, no, you may not speak? What you are saying is contrary to what the World Health Organization believes, and therefore, and part of what I have done since that original video and in chats like these is to try to point out some of the inconsistencies, the vast inconsistencies, that masks no one should wear masks, then they're mandated, we should do this or that. They've changed, they've flip-flopped on so many things, whether it's social distancing or mask wearing, hydroxychloroquine, school closures, whatever it is. And so part of what I've tried to do is point out the inconsistencies, the illogical nature of it, the fact that certain activities are good. You can go to a liquor store or a marijuana dispensary or Costco, but church is bad. And, Trump rallies are bad, but protests are good. I mean, there's just an inconsistency and an illogical nature to it that I think really needs to be pointed out.
And that inconsistency, hypocrisy, excesses, that is what makes for horrible health messaging. It's how you lose a population.
Right.
I went through this. I most of my life I've been trying to give out health messaging. I started with HIV and AIDS. We exaggerated that. Now we can't get somebody to wear a condom. There was a
Right.
generation before me that exaggerated cannabis. Now no one will listen to anything about potential risk benefits of that drug. You just go right down the line. Whenever the health messengers are excessive, hypocritical, inconsistent, you lose the population for good. They don't want to hear anything. And this is not the time for that. But they did it. They did it, and they keep doing it, which is crazy. It's super crazy.
No, and I think, we've heard a lot less about it in the past couple of weeks, past maybe 10 days. I've noticed a decrease in the amount of talk about COVID-19. And I'm wondering, I think it's a couple things. I think number one, there are other things taking over the news cycle.
Right.
But I think more importantly and more critical is that people are developing what I call crisis fatigue. I do a lot of crisis management. I'm a mass casualty specialist, a disaster specialist. And after a while, people develop crisis fatigue. They just say, the sky can't be falling every single day. And if you ask a group of people, I have never said that the virus isn't real or that it's a hoax or anything like that. I've never implied that. But if you ask a group of people, Drew, if you had 5,000 people and say, do you personally know anyone who's died of this? Do you personally know anyone who's been admitted to the ICU? Do you personally know anyone who's been admitted to the hospital? Do you personally know anyone who's gotten sick enough they even needed to get medical care for COVID? And when people start saying, gosh, I don't know anybody. I mean, I've heard about people who've died. I've heard about people who are in the ICU. I've heard about people who needed to go to the hospital. But people start to say, wow, maybe there's something about this that doesn't make sense. And then, as you said, you start to lose the public trust, which is the worst possible place we can be in as public health experts, because you get one chance at this. You don't get to retract and say, yeah, okay, we kind of overshot on that. We destroyed lives. We decimated the economy. We ruined your kids' education. But this time, listen to us because we're really serious this time.
Drew, did you see Eric Anderson's question?
I don't think I did.
About, do you have any concern of people being dissuaded from getting the vaccine for political reasons?
Sure. I mean, because everything about
If it's
what we're doing,
Trump's
everything is getting politicized. Everything, and people are.
So Kamala Harris came out today and we was asked if she would take it, and her response was, "I would not take it because I don't trust anything coming out of President Trump's mouth."
Yeah,
and that's just irresponsible.
Is that
because
where the vaccine's coming from? Out of his mouth?
Right.
That's interesting. That's really funny. Yeah, it is very, very concerning. All of this, it's beyond. Crisis fatigue. I definitely have it myself. Absolutely. That's why I'm saying, give me the vaccine and be done with this. I'm moving around the world. I'm moving around the continent a little bit because I don't want to think about this anymore.
We're very isolated in Pasadena, and it's certain areas don't see a huge virus.
I've seen plenty of cases. Most of them have been mild, but I've seen death.
I
and
don't
I've seen
know
ICU.
anybody.
I understand you don't. You don't take care of patients.
No, I'm not. Well, you're different. I'm talking about the average person.
Right.
Like my nail lady, she can't open up her salon. She hasn't met anybody who's had it. It's not like we have a million cases.
And it's not like, look, this is the insanity. It's not like nail salons are ground zero for distribution and spread of the virus, number one. In California, by the way, they're letting the hair salons open up at 25% capacity. 25%. That's the magic number. 25%.
Who's going to count?
What is the science? Zero. No
Right.
science.
Well, Drew, the most frightening thing about Gavin Newsom's new color scheme was the lack of. I looked at it and it says it goes purple, red, orange, yellow, and I'm thinking, where's green?
I know.
Where's green?
Don't worry, we're never getting there. We're never going to green anyway.
There's no green on there. I mean,
Yeah.
who develops a plan? That's public health 101. You have to at least tell people what do you need to do, no matter how high the hurdle is, no matter what hoops you got to jump through. at least you've got to tell me, what do I need to do to get to green?
Oh no, he did. He
Get back
made
to the
he made yellow green essentially. Yellow is green, and yellow we can open up, and we have to have for a week one case, meaning one viral RNA particle per 100,000 for a week.
Which will never happen.
Will never happen.
It will never
and
happen.
Even when the vaccine is widely distributed,
Correct.
we won't be able to get there.
Correct.
So this is a kind of a nuttiness that we're dealing with here in California.
Right.
Jesus.
That's correct.
Okay, I am so fatigued. I can't even tell you. Personally, the mask thing for me is like, it looks like that's contributed significantly to helping, at least here in California. And let's just all do it, because we have a Gestapo ruling us here, and we got to do whatever we can to try to get this thing down, because they're literally destroying the state. And the consequences are profound. People are staying out of hospitals and delaying medical care. They're flooding in now. Suicide up, opiates up, homeless up, opiate overdose up, delay in medical care and complications as a result, or through the roof. I can't abide by this. We got to do something.
Well, you're absolutely right that what I call COVID lateral damage is significant and is far greater by an order of magnitude than the impact of the virus itself. And what I mean by COVID laterals is those people who are not getting routine medical care, who have avoided going to the hospital, who have skipped screenings for mammograms, colonoscopies, those sorts of things. I just heard a statistic the other day out of California that diagnoses of lung cancer are down 62% here in 2020. Right. And unfortunately, I'm here to tell you that's not because lung cancer has somehow miraculously gone away in California.
That's right.
It's because people aren't getting their screening exams. We're seeing this with diabetes. We're seeing, hard delayed diagnosis of heart attacks and stroke. What do you tell that patient who comes in and says, I got my mammogram, yesterday, September, whatever. It was scheduled for February. I didn't get it till September. There's a mass. Tell me, doctor, would things have been different if I'd had my mammogram back in February? I mean, how do you answer that patient? Because the answer is likely, things would have been different if we'd found this 6 months ago.
Absolutely. And the same thing with the lung cancer.
Yeah.
That's our one chance of really getting this thing, is getting it super early in some cases. And we're going to lose that window. For now, it sounds like 50% of cases. It's just so ridiculous. Any thoughts about long haulers?
About
the long haulers, the post-viral syndrome, but let me just say, everybody, let's not make much of it, because after H1N1, I had a post-viral syndrome. Bad viruses have 1918 flu. The one of the most famous psychiatrists in the history of United States, a guy named Menninger, believed that the 1918 flu was causing the majority of psychiatric illness that he was seeing, including psychotic illness, depression, something called neurasthenia, which we just call chronic fatigue. And the immune cells and brain cells develop together. So things that infect immune cells affect the brain cells too.
And there's no question, as you said, COVID-19 would hardly be alone in this. If you had some ongoing inflammatory things, including myocarditis, some inflammation of heart muscle.
Maybe. We don't know. That got revamped. Did you see that?
Right. Exactly. Because they didn't do any baselines.
Right.
But if you told me that there was some delayed impact, neurological impact, we know that Epstein-Barr virus, lots of things, mononucleosis, lots of these viruses can cause protracted illness for a period, whether of weeks or months following your recovery. So COVID-19 would not be alone in that. The good news is most people fully recover without other event. It just takes a while in some people. So COVID-19, I eschew the idea that it is somehow unique in that, because as you said, many, many viruses have delayed viral syndrome.
We did a interview with Dr. Patterson a couple weeks ago, and he was suggesting that he's found some abnormalities in the Rantes system in the persistently sick, and that there are some medicines now that'll help modulate that. So there might be some treatment for it coming.
And I'm guessing that steroids might play a role in that because some
For
of it
sure.
again is inflammatory in nature and it's an ongoing immune response long after that immune response is really warranted.
You know, it's interesting. I had infectious mononucleosis when I was 17, and I went bad, like with every virus. It was getting really bad, and to the point that it frightened my father, who was a family practitioner. I had massive splenomegaly. I was just toxic. And they took me to some internist who gave me a brief trial of Decadron, and it turned the thing around like that, which is fascinating, right? That now we're talking about Decadron as a treatment for what probably was a cytokine syndrome of some type.
Precisely, and
Yeah.
and that's exactly the way I explain it to people in lay terms, is that your body is continuing to fight a fight that's over, and it's causing problems, and so you can calm that response down frequently with steroids. I know many people actually who had the exact same thing, had a protracted illness following something like mononucleosis,
Yeah.
and needed a course of steroids just to say to your immune system, okay, it's okay now. You can go back to normal. The fight is over.
So Leopold is asking, is there a state of apathy or a sense of assured infection contraction that is contributing to a collective depression in the population? So I think hidden in Leopold's question is part of crisis fatigue a mood disturbance? Mine is. Mine for sure is.
Oh, there's no question. I think truly people who have never suffered from depression ever in their lives are reporting being depressed, or if they don't use that term, brittle.
Yeah.
They are brittle. People are in short fuses right now. There's no question. I think it's more apathy than and just frustration, a feeling of helplessness.
But helplessness is, think about it, we use helplessness as a model for depression in animals.
Exactly.
We
rather than, I don't think it's fear that people are sitting there depressed or bummed out because they're saying, "Oh my gosh, I'm going to end up getting this
right.
bad."
I agree with you.
I don't think it's fear of illness. It is apathy combined with depression and all the things that lead up to it, hopelessness, isolation, the fact that people are starting to say, is it ever going to go back to normal? What does normal even mean? People are locked at home with their kids, which is stressful for anybody.
Yep.
And people are seeing their businesses suffer. They're seeing their future
destroyed.
People don't know what to do.
Somebody on the thread, Jenny, says, sad, mad, angry. I think that pretty much characterizes the crisis fatigue syndrome.
I feel elderly people, Drew, I really worry if this continues into the fall holidays.
Well,
if you told me back in Easter that we'd still be doing this later.
I wouldn't believe it. I wouldn't believe it. And look, if you're think about this. Why don't people ask old people what they want to do with this?
Right.
What's the case fatality rate for a 75-year-old? Like less than 2%.
About 4%.
2 to 4%.
Yeah.
All right. So 96% probability you're going to make it through this thing.
Right.
You're 75 years old. Your probability of living to 83 is so you have about maybe somewhere between 5 and 10 years left. You want to cash in 10% of that? You want them to take away 10% of your remaining time, guaranteed loss. You do nothing for 10% of your remaining time on Earth, for the risk of 4% that you die of a virus that you might not even get. I mean, if I were 75 years old, I would have none of that. I would go about my business. I would wear a mask. I wash my hands, but I would go about my business.
You're going to be that crotchety old guy.
Precisely, and people are saying, "Look, this is hell on earth. I'm living in this place separated from my family. I can't see my grandkids. Looking at people through a window. I haven't had human touch in months." Other than from some caregiver who's bringing me my meals in my room. I mean, it's devastating. It's cruel. We wouldn't do this to an animal, let alone to our own parents or grandparents.
Are you referencing that you're isolating your dog out there and he's angry with you? Is that what you're doing?
That's either the UPS man with my most recent Amazon purchase, or maybe or some mostly peaceful protesters showing up for early trick-or-treating.
Oh boy. Oh boy. You and I think, disagree a little bit on the mask. Why not masked? What's the downside?
Well, I think, first of all, I don't think there's any science behind it, Drew. If you look at the studies on respiratory viruses and the impact that masks have on controlling respiratory viruses, I believe that the studies are really quite conclusive that they don't do anything. And then there's some significant downside to wearing them. It's not just an inconvenience. People actually increase their risk of developing infection because they touch their faces incessantly. They touch their eyes incessantly. We're seeing a huge increase in skin infections around the nose and mouth. Those are their staph and strep primarily. Big uptick in conjunctivitis, which is.
I have a question. Can I interject here?
Yeah, go ahead.
Because I have this like mask etiquette thing. When you wear your mask, you shouldn't set it on a table, and you should not stick it in your dirty pocket with your keys. Put it in a plastic baggie, and maybe also wash it occasionally.
And that's a great suggestion, but people don't do it. People keep them shoved above the visor in their truck or in the center console. They're walking into the grocery store and they say, "Oh shoot, I need a mask," and they're trying to find one buried at the bottom of their purse. So. Seriously. And then, there's a reason that we do things like cough or sneeze. That's the body's way of trying to get rid of something that you don't want in your nose or oropharynx. That's why you cough pollen out or dust particles out. If you instead catch them in the mask, and on the very next inhale, all you do is suck them back in. So I think that it's really twofold, or maybe threefold, because the third thing is I don't believe in validating science, things that aren't scientific, just to make people feel better. It's really, we are propagating things and leading people to believe something that isn't true. So it's not scientific. I think there's significant downside, not only physical, but also psychosocial downside. I worry about the kids who are walking into grocery stores. I look at these 2 and 3-year-olds. They may not be wearing masks because they're under the age that they have to, but they're looking at a sea of faceless people. At a time when it's really the fundamental developmental time for children to learn those nonverbal cues, learn how to interpret facial expressions, see someone smiling at them and notice smile back. Look at those sorts of things. It is not insignificant that kids are going out in public and they never see that now. And who knows if they ever will again if we don't get off this crazy train.
They're not bonding.
I'm going to send you results from a symposium of engineering and science and medicine talking about masks and aerosols and environments and all. It gets pretty complicated.
Nobody talks about how to wear a mask, when to wear a mask, like when to clean a mask, when to not to put your mask. And
people ask a lot. People ask me a lot. They'll say, well, if they don't work, then why do surgeons wear them all the time? So let me just clear that up. There's the reason surgeons and physicians wear masks when we're doing procedures is to keep us, number one, from being inadvertently sprayed in the face by a bodily fluid, generally blood or some other bodily fluid, to keep that out of my face, and to keep me from inadvertently coughing or spitting into an open wound. That's it. Not to keep me from spreading a cold or a virus or anything else I might have to the patient. It's purely to keep me from inadvertently spitting into a wound or coughing or sneezing into a wound, and to keep me from being sprayed or splashed with blood or some other bodily fluid.
Yeah, but you don't take the mask home in your pocket and then put it on later.
Correct.
You get a fresh one.
You don't wear. You're darn right, and you don't wear it 24 hours a day or hours at a time. Masks are also worn. The surgical masks are intended to be worn in sterile environments where there isn't pollen and dust and all sorts of environmental particulate matter that clogs those things very, very quickly. Surgical masks weren't meant to be worn outside or to the grocery store. They simply clog up too quickly, and you just end up breathing around the sides and exhaling around the sides.
I like the paper ones.
That's what she's talking about.
They're good.
Yeah.
You can throw them away.
The study out of Duke University showed pretty clearly that the gaiters that a lot of people wear, instead, pulling up a facial shield made out of cloth, actually increases the risk, because as you breathe through it, small respiratory droplets get broken into multiple tiny respiratory droplets that travel further. So the Duke University study actually showed that face gaiters were more likely to increase the spread of a respiratory
that did
virus.
not. The Gators did not look good.
Yeah.
What should we do with kids?
Yeah, I'm so worried about people
Oh my
with their kids.
God, if I were queen, I would open up all the schools tomorrow.
Yeah.
Fully.
Yeah.
No plexiglass shields, no face masks, no social distancing. Children are essentially at zero risk from this illness, Drew. They not only do they not get sick with it, but they are unlikely to spread it. And we know
Right.
that. We know that from all the countries around the globe that opened up.
Right.
Children are not vectors for this illness, and they sure as heck don't get sick with it.
Right. So the only they don't get sick. That's for sure. They don't even. It doesn't get in. They don't even have the receptors.
Yeah.
And then, as we said earlier, we have the T cell responses. But there still is. I guess back to the science. Do we have science that they don't spread it? I'm not sure we have that yet. Do we?
Well, what we have, I'm not sure you can call it science. What we have is experience. We know from all the European countries that opened up, they didn't have one case.
Hey, Rex.
Where
Sorry, now our dog's getting in the
dinner.
app.
oh,
Come
good,
here,
son.
come here. He's John. Come here.
This is the joy of home studios, but
It's like having our kids here.
but we have just tons of science from all those countries that opened up. Not one of them was seeing spread from children to a teacher or to parents or to elderly grandparents at home, which was the big concern. So kids just are not a significant vector of it. The virus particles, it is conceivable that they spread it, or that they could spread it, but we know they seem to just wipe the virus out very quickly in their own noses and oropharynx so quickly because of their T cell response that any virus particles they have are not likely capable of replicating or causing disease.
Eric is asking, is there a scientific justification for keeping playgrounds closed? No.
So,
Most of
no.
what California is doing has no scientific basis for it, in spite of them invoking the name of science all the time. That is offensive, frankly. Offensive.
Earlier, somebody said the schools are closed, but Chuck E. Cheese is open.
Right. Right.
No, and exactly, the idea, for example, that playgrounds, beaches, swimming pools, we know that your risk of contracting this virus is infinitely higher indoors than outdoors. Okay, it's infinitely higher in an air-conditioned environment
Yep.
than outdoors in the heat and in the sunshine. We know that UV light, for example, is very effective at killing off this virus and
So I have
other viruses.
bring my UVC, but yes,
Yeah.
outdoor UV is even better.
Yeah. So why would you close a playground?
Right. It's ridiculous. It's bizarre. It's truly bizarre. It feels punitive and insane. And it seems like people who just like to have power over other people exerting that power for no good reason.
And unfortunately, Drew, you just hit the nail on the head. That is why I don't know where the end game is.
Right.
Because I used to say, if you'd asked me back in May or April, when is this thing's going to end? I would have said back then, oh, it's going to end on November 4th. Regardless of who gets elected, it's going to end because there's the political expediency for this virus is going to end on November 4th.
It seems like it.
Unfortunately, I don't believe that anymore.
Yeah.
I believe it's been so internalized and people have become so intoxicated by the power of being able to, as you said, this punitive,
It seems like it, right?
so they're using it as a cudgel.
Yeah.
If you do this, if you go out and you disobey me, I'm going to shut down the hair salons. If you disobey me, I'm going to keep the playgrounds closed. If you don't do what I say, there's an intoxicating component
There
to this
seems to
power
be. There seems to be.
that I don't see that this is going to end on November 4th the way I thought some months ago, because I think it has been internalized and because we have elevated this virtue signaling to truly an Olympic sport.
Well, an
It is
insane
become-
level.
Yeah. Oh, yeah. It
No
is-
death. And one death is too many. I go, wow, how about highway deaths? One death too many? Oh, one death too many? Well, then we can't drive. No
Right.
driving.
Right.
No driving.
Or you're a bad person. You're selfish. You're a bad person and you're selfish and uncaring if you don't think that we should wear a mask, or if you think that schools should be reopened. You don't care about the lives of teachers. these insane comparisons that are being made. As you said, I care very much about deaths. I don't want children to drown either, but I don't think we should.
I don't want them to die of overdose and suicide. Right. I don't want their trajectory of their children's development to be altered forever. Correct. And their mental health to be altered forever. I can think of all these other things that are going to happen because of the continued nonsense.
Exactly. COVID lateral damage is real. And to claim that somebody is uncaring or selfish because they don't, buy into some of this, you've got to look. The mandate of public health is always to look at the ramifications, the implications, and the response to any particular mitigation effort. And we are ignoring that. The public health experts have ignored that.
Completely.
The rest of that be damned, as long as we can avoid the spread of this one virus.
Somebody on YouTube had a good question. They said, how old are you when you get the receptors to carry this? Or
it's a good question. Late teens, typically.
Yeah. Does it happen with puberty?
Around there.
Probably, 16, 17, 18 is when it appears that you become capable.
And then it's still,
which is when they want to go out and party.
Yeah, but still, right. But even when you can get the infection, nothing much happens to them. It's rare to.
Don't get sick.
And by the way, I was looking at some of the so-called Kawasaki syndrome here. This is the post-inflammatory syndrome you heard people talk about here in Southern California in the late teens. And I was looking at the rash on their hands. It's typhus. They're underdiagnosing typhus. We have a typhus outbreak here, and they're calling typhus Kawasaki syndrome. I guarantee you, a lot of it is that.
I agree.
They're just jumping to Kawasaki syndrome every time a kid comes in with mouth and a hand rash.
Right. The number I've said from the beginning, the virus is real. The statistics are not. The number of people who have been mislabeled, misclassified as either COVID deaths or COVID in general. I mean, even the CDC now acknowledges that the number of false positives because of this PCR test are huge. So the virus is real, the statistics are not. And unfortunately, that's a problem when you've got someone like Gavin Newsom and his group of advisors who are using cases to direct public policy rather than using actually sick people, hospitalizations, ICU admissions, and deaths.
And measuring it against other phenomenon that we have to worry about medically. What do you think colleges should do? University and colleges are having these little outbreaks.
I don't care. They should open up. I don't care if they're having outbreaks. What you mean again is they're having positive cases. They are clinically insignificant. We need to look at cases of clinical significance, and none of them. You look at the numbers from all of these. University of Alabama had something like 44,000 new quote unquote cases with no one even needing to go to the doctor. But if they keep them on the campus and quarantine them there, then they won't spread it to the rest of they shouldn't go home. You are correct. The last thing you want to do is close down the campus and send them home, because when they're on campus, if you truly want to stop the spread of it, then great, have them there at school you'll come very quickly to herd immunity on the campus. It's a captive audience. The last thing you want to do is close the campus so they can all go back to the four winds and spread it to their communities.
Oh my God, if my kids couldn't have that wonderful babysitting center called 4 years of college and they were home through the whole time, I would probably want to cry. I would be so happy. I'd be like, just go. And if you get it, we'll just make sure you're okay. And then you'll get over it. My son got mono in college, and I had to go hang out with him for a week.
Well, we thought he might have had lymphoma. That's why that was.
But a lot of people had mono, and they didn't close the school down.
No, they're young, healthy people. They will if they have symptoms, their symptoms will be mild. They will get over it forthwith and go on with the rest of their studies. Same thing with all these athletes.
Right. So I agree with you on all that. That there was some vitamin D news this week. Where do you come down on that?
Well, first of all, I think most Americans, as you know, are vitamin D deficient. Mm-hmm. So clearly, supplementing vitamin D. One of the things that's been lost in this entire discussion, truly, is all the simple things people should be doing to improve their own immune systems. I mean, people should be focusing on those things like adequate sleep, adequate exercise, good nutrition, supplementing those things that we know most Americans are deficient in, which includes, vitamins B and vitamin D and zinc and vitamin C, all of those things. And so I'm a huge proponent of doing that. It's fascinating to me, the same people who will look at you sideways or criticize you for not having your mask over your nose as they carry their McDonald's bag out and pick up a pack of cigarettes. And they're talking about how I'm risking their health by having my mask pulled down. I'm thinking there are an awful lot of things that people should be doing to improve their health and wellness, and certainly to work on having a healthy, functioning immune system that we could be doing. And vitamin D is certainly one of those things.
I guess we should go do one more round with hydroxychloroquine. Still stunning to me that we don't have the right studies. We don't have. It was always designed for the original publication by Dr. Now I'm blanking on his name, James Todaro. Todaro. He looked at the studies on SARS-CoV-1 or SARS coronavirus 1 and said, oh, it's good antiviral activity. Showed it again in SARS coronavirus 2. We should be using it with zinc in early disease. And now all we have is studies showing it without zinc in late disease. And nobody's seemingly doing the studies. What is going on here?
Correct. And there's been no large study done, but God knows we have thousands and thousands of patients who've been effectively treated with it. There are lots of physicians. I meet on a weekly basis with telephonically with a huge group of evangelical physicians from around the country who have used it with incredible success. As you said, it needs to be used early and it needs to be used in conjunction with zinc. But let's face it, there are very few antivirals or antibiotics, for that matter, that do their best when used late in disease.
Right.
If you have a patient who's septic from a bacterial infection, meningitis or whatever it is, if you don't initiate antibiotic therapy until they're going into the ICU, your chance of survival is very, very low.
Right.
So hydroxychloroquine isn't alone in that. The safety profile is excellent. It's been around for 65 years.
I've been prescribing it for 35 years. Please, it's ridiculous. In fact, I was just doing the MKSAP last week, and I did the rheumatology section. And of course, they're advocating hydroxychloroquine. MKSAP is a thing for internists to get your continuing medical education done. And they were advocating it for lupus and everything and how safe it is. They even went so far as to say in a pregnant woman with lupus, do not stop hydroxychloroquine because it is totally safe in all circumstances.
Precisely. So the fact that there isn't a random controlled trial study on it for COVID-19 really doesn't bother me. The idea is it's dirt cheap. It's about $12 for the entire course of treatment. Hydroxychloroquine is over the counter in almost every other country because it's so critically important for the treatment of malaria and so widely used for things like rheumatoid arthritis. So the US is one of the few countries where you need a prescription for it. So the safety profile of it is not in question. Yes, we ultimately would like to have a random controlled trial, but the idea that we don't have one, let's face it, so many drugs, it's like 50% of all medications are prescribed by physicians, quote, off-label, meaning we use them for something for which they were not initially intended. We use verapamil, for example, which is a common blood pressure medicine to treat migraine headaches. We use gabapentin, which is an anti-seizure medication to treat chronic pain.
And anxiety.
Right. We use, 50% of all drugs are actually used, quote unquote, off label, meaning they're safe, they're FDA approved for one thing, but doctors know and use them to treat something else.
And this is what people don't understand. We are entitled to do that. That is our scope of practice.
Correct.
The drug companies aren't allowed to promote off-label use.
Correct.
We are able to use the drugs however we see fit.
Exactly. Once a drug is FDA approved, your body doesn't know if you're taking the hydroxychloroquine for lupus, for malaria, or for COVID-19. It doesn't become less safe when you're taking it to treat COVID-19. And therefore, physicians are able to prescribe an FDA approved medication, a medication that's safe for whatever they choose to prescribe it for.
And to be fair, I used to prescribe a lot of chloroquine for malaria, and people do get funny mental status changes, and they can even hallucinate and stuff. But there's nothing serious from it. It's used all the time. So And I know hallucinating sounds serious, but they're actually kind of mild symptoms. All right, I think we've run the bases, as it were, Kelly. I mean, I'm looking at my list of things I wanted to talk about. Is there anything you're worried about right now? Or is there anything that not necessarily keeps you up at night, but that really frustrates you more than what we've discussed so far?
Well, I think what I'm most concerned about is the continued doubling down in what I consider to be government overreach on everything from the mask mandates to closing of businesses, and the idea that they could keep these schools shut down. A place like California is not likely to get back to business until well into 2021, based on these new guidelines, these new color codes. And I really worry about that, because there comes a point, Drew, where we are at the point of no return on many of these businesses.
Yeah.
Of them, many
It's
of them.
so weird. I mean, do these states and these cities not understand where their revenue comes from? It's so weird.
Right.
What's their
Precisely.
plan?
No, and so that's really my biggest concern.
Yeah, I'm worried about that too. I mean, it really. Oh, somebody, I wanted to ask you about this. Somebody's asking about quercetin, which is something that Dr. Zelenko advocates.
Yes.
I talked to Dr. Todaro about that. He wasn't aware of enough data to really recommend it. I take it, but I don't recommend it because I can't find enough data either. What do you say?
Well, quercetin, the reason it's easy to get, it's over the counter. Quercetin is another zinc ionophore. Hydroxychloroquine is a zinc ionophore. It essentially opens the door of the cell to allow zinc to go rushing in.
Exactly.
And it's believed that the zinc is actually what wipes the virus out or makes it unable to replicate and therefore cause disease. Quercetin is the same. It's a zinc ionophore, and it's easily accessible. So a lot of people, you take 500 milligrams of quercetin on a daily basis as a preventative, along with zinc. Many people are using that for prophylaxis.
Yeah.
Again, don't ask me for the random controlled trial, because it doesn't exist. But it's very similar mechanism of action, in that it allows zinc from the bloodstream to get into the cell.
Yeah, I take it, but I don't have enough data to be recommending it to people yet. Also, N-acetylcysteine was used for a while too. Any opinion about that?
I don't know. Yeah, NAC is normally used to treat, to treat
Tylenol overdose.
Tylenol overdose.
Yeah.
I'm unaware of it being used for COVID-19, but again, I'd have to think about what the mechanism would be with quercetin.
Yeah.
I know what the mechanism is. It's because of the allowing zinc to actually enter the cell more easily. I'm not sure what the mechanism would be for N-acetylcysteine.
Are rational physicians like yourself and Dr. Jensen gathering together not just to advocate for the ability to have normal medical discourse? I know that Dr. Todaro and people like that have sort of done that already, but just pushing back on the intrusion into our practice by people who have no business even commenting?
It's a great question. I mean, I did my part in defending myself to the medical board, which, as I said, I was able to do very easily and very successfully. But it is scary that people would even go down that road. I am trying to bring more exposure to the idea that censorship is very, very real, and cancel culture is very real. So if people need to understand that when they go to Google or Facebook or YouTube or Instagram, wherever it is you get your information, and people say to me all the time, well, I Googled it and I did a Google search and this is what I read. You have to understand that what you are being allowed to access there is being heavily censored. Articles that are written by alternative viewpoints likely will never make it into your search results. So that you need to be, if you truly want to know what the truth is, if you really want to get the data, you need to dig a lot deeper than going to one of those sources. You need to maybe go to the library or do a Medline search, because going to Google is heavily censored. I find it terrifying, and I was telling you before we went on today that back in 2005, I spent a lot of time in China. I was the chief medical officer of a company that was looking possibly to do the medical care, to run the medical services for what was going to be the 2008 Olympics that were coming up in Beijing. So I made multiple trips there, and I did a deep dive of all of their hospital sourcing and their healthcare services over there over a period of a number of trips. And I met a young woman who I became very friendly with and subsequently brought to the United States. She was desperate to get out of China, and I helped her do that. And she worked for my company. And she told me a story. And the reason what was so compelling is she said that her grandparents were physicians who had been exterminated, had been executed by Chairman Mao under a communist regime.
That was the Cultural Revolution.
Yes, during the Cultural Revolution. And she was telling me that story, and I remember thinking, oh my Lord, how fortunate I am to live in the United States, and that I would do anything to help bring one person to get them out of that repressive, horrific regime. Now, 15 years later, I'm living in a country that's attempting to silence physicians. It is terrifying. If you don't think it can happen here, you don't need to actually execute me to silence me.
Right.
Because right now, with social media and the ability to cancel people under cancel culture, it is so easy to silence somebody without actually executing them. But the outcome is the same, Drew. The outcome is the same if we go down that road. And so I think people really do need to be aware that this is happening, not just to myself. I'm not, out there alone. As you know, Dr. Stella Emanuel and Scott Jensen and many others are out there now fighting this fight. But people need to pay attention because censorship is real, and book burning is book burning, whether it's virtual or real.
That's right. We have electronic book burning now.
Correct.
We have the bonfire of the vanities. People always looked at that during World War II and went, "Oh my God, why didn't somebody turn around then? Why didn't they stop it at that point?" We are doing it now electronically. We have electronic book burning, 100%. And for people back to the idea of somebody being able to do a Google search and really understand medical literature, all we do as physicians is read medical literature, and we have to understand the sweep of what's out there, and then how to contextualize whatever literature is you're reading about a particular topic and what's available on that topic. You can't do it if you're not trained to do it, and if you don't understand the full spectrum of what's out there, the sweep of what's out there. So again, it's censored, and people aren't trained to do it. So it makes for a lot of misinformation. That's why the Dunning-Kruger effect lives large. You know what the Dunning-Kruger effect is?
Oh.
Dunning-Kruger effect is a cognitive distortion that essentially, it's the same thing that lets people stand up and audition for American Idol when they sound like hell and then say, "See, wasn't I great?" It's a distortion based on an incomplete knowledge base. They have not been exposed to the full. So when somebody learns about a topic, they first have Dunning-Kruger, and then after studying it further, they realize they don't know anything, and then they develop some expertise, and then they have the imposter effect. when they actually know something, they feel like they know nothing. But Dunning-Kruger is this excessive confidence in what you know when you really know very, very, very little.
Well, and unfortunately, we have, we have icons like Joy Behar and, people out there talking about things that they know nothing about. And people in Hollywood talking about hydroxychloroquine or talking about vaccines or talking about masks. And I really think that we've done ourselves a disservice by sidelining physicians, practicing physicians in particular, people who are on the front lines, people who actually put a stethoscope on the chest of a patient on a regular basis and can say, look, this is what's going on. This is what we're seeing. Here's the increase we're seeing in depression and substance abuse. Here's the, real life things rather than all this esoterica that's going on up in the ivory tower.
Kelly, as always, thank you for joining us. Dr. Kelly Victory, where should we send people to find you and follow you?
Believe it or not, I've got Twitter at Dr. Kelly Victory, or my YouTube channel, and I will post this on my YouTube channel once it's ready to go. At Victory Health Inc. is my Victory Health Inc. is my YouTube channel.
Victory Health Inc. Is it YouTube/Victory Health Inc.? Is that how we get there?
If you just go to YouTube and then
look
search
it up.
Victory Health Inc., it'll come up. There are other Victory Healths, but mine's Victory Health Inc. And at Dr. Kelly Victory is my Twitter, and I'm pretty active on Twitter.
Kelly, it is always a privilege to talk to you. Thank you so much for spending a little time with me, and say hi to Ron for me.
Will do.
Okay.
Thanks.
Bye-bye, Kelly.
Bye.
Dr. Kelly Victory.
Tomorrow we have
Susan?
Ask Dr. Drew.
Yes.
We
We
have-
can't hear you. Your mic's not on.
Tomorrow on Ask Dr. Drew, we have another doctor who was censored on a previous show. He told us all about it, but he has a new book about prostate cancer.
Yes, we'll talk a little about that. Didn't we have a second guest with him?
No, not yet. But also,
Meow.
are you going to talk to your
Meow.
fans for a little bit?
Sure. Why?
I'd like to have a word from our sponsor.
Oh, let's
With
do
so
that.
much focus on keeping ourselves and our loved ones safe and healthy, it's easy to forget that most of us are going to experience things like allergies, colds, possibly even the flu. So, reminding you, proper hydration is crucial for all of these things. Remember, even slight dehydration can make you feel like you're getting sick, and none of us need that anxiety right now, that's for sure. That's where Hydrolyte comes in. Longtime fans will remember my obsession with Hydrolyte, which is simply the best oral rehydration product I've tried. I'm even more excited to introduce their brand new single-serve powder sticks. Simply pour 1 powder stick into a glass of water. They recommend 7 ounces. The powder dissolves almost instantly, creating the perfect balance of sodium, glucose, and water. Delivers up to 4 times the electrolytes of your typical sports drink. The other great news about Hydrolyte's new powder sticks, they're 100% all natural. No artificial flavors, colors, or sweeteners. They're available in flavors like orange and lemonade, and they taste great. Hydration is crucial, and Hydrolyte is fastest and easiest way to stay ahead of it. Get your supply of Hydrolyte powder sticks now at hydrolyte.com/DRDREW. Again, that's HYDRALYTE.com/DRDREW, and then use that code Dr. Drew 25 at checkout.
We are back, and of course, our friends at Hydrolyte there in the powder in the corner, you can see. All right, let's see what you guys are up to. I want to get, how do I feel about everyone getting a flu shot? Cindy, do it. I've had it already. I gave it all to my family. We do not want, if you haven't learned anything from this thing, have you not learned that it's important to get your vaccines? Let's see, is there anything in the U.S.? Let's see what you guys are into here. Yeah, so
Lots of good questions during the feed.
yeah, I tried to get to the ones I could get to. Flu shot was easy. Good. Yep, it was easy. Back to I am not saying that people shouldn't Google information. They should be as informed as possible. But understand you have very, very limited information just from Google, and that if you want to really examine something, you got to read the medical literature on not just that topic, but the topics around that topic. That takes a lot of time and a lot of effort. And you can always just, once you've sort of educated yourself, just talk to your physician about it. That's the more efficient way of doing it. It's our job to read all the literature. I did hear about the AstraZeneca vaccine we talked about with Dr. Victory earlier.
She does not hold back.
No, she's very against the masks, which that's fine.
Not me.
I'm for masks because I think it's working, and there is some science. I need her email, Susan, so I can send her the science. Actually, I have some.
Okay, not in a
stuff
second.
I'm going to send to her. Yes, Leopold, I did see the symposium, and I'm going to send it to Dr. Victory. That's what I was just saying. The virus does not do well in sunlight. Playgrounds should be open. Salons should be open. Nail salons should be open. As I keep saying, the science on the salons is that there was 2 women with COVID actively secreting virus in Arkansas, wore masks, did what they're supposed to do in the salon, and cut the hair of 140 people, not one transmission. Yet when they went into the break room to get their mask out, they got their colleagues sick.
And it's not about the people not being able to get their nails done. It's about the people who run the businesses that have to close. And
Right.
our friends who have been the local gym operators in town, they had the biggest, it was like an Equinox. They had to close down. And, 20 years they've been in the business, and now they have to do all virtual stuff. Their rent was like $65,000 a month. Couldn't pay it. It's just awful. I mean, same with gyms. There should be a way that healthy people can go to the gym.
Agreed with that, 100%. Wear a mask. I really think the masks work. I really do. That's my
I don't
opinion.
have to get my nails done, but I feel bad for the people who make a living doing it.
Tom Cigar, that is exactly right. Maybe she'll be. Tom Cigar says, I call BS on Dr. Victory's mask stance. Fine. And she's entitled to her opinion, and we'll see who's right in the long term.
I kind of agree with the with what do they call it when kids use your face for reactions when they can't speak? They use your facial expressions to connect with human beings. How
Oh yeah, what she's saying about the mask. She's absolutely right about that.
like
That
2 or
is-
3-year-olds, you
yes.
know,
Oh yes. It's not good
they
for
can
them.
tell when you're sad or when
They
you're
need
happy.
they
or
need facial expression. They need the subtlety of facial
it's
expression.
going to be something weird that comes out of that for those kids.
Yep.
You know,
Yes.
A
we
whole
don't
year.
know. We don't even know. I mean, it could be awful. Really, it could be.
right?
Um,
I would be bummed.
For the playground closures in Pasadena, Eric, the mayor of Pasadena and the public health department here. We have our own public health thing separate from LA County.
Yeah, but they're
Um,
pretty tight over here too.
No, Leopold.
We're in LA County.
She'll Leopold. She has not lost credibility. We will adjust her. We'll adjust her opinion with the information you've given me. Mask does not protect a person's eyes. That's why people wear the face shields. But the probability of getting it through their eyes is extremely remote, unless you work in an ICE or some place where there's massive aerosolization.
Just so you know, Drew and I believe in masks. So
Yeah. Well,
I feel
we'll
bad
see.
about
We'll see. In
kids,
the
like-
meantime, something's driving things down now dramatically. I mean, if you look at the data, things are really falling. The case rate here in Los Angeles, 439. We were at 4,000 3 weeks ago. In Orange County, it is 150. They were at 300 3 days ago. I mean, it's going fast. I'm mostly looking at California. In California, the case rate is now the lowest it has been today. We're at 2,600 cases. Last time we were at 2,600 cases was, 2,600 cases was in May 1st,
I don't
May
know.
2nd.
I wonder how all those people on COVID Island are going to do this week.
I don't know. You want to put a picture up?
I
of
don't
Kobe
have it
Island?
here.
If you saw us yesterday, we were making fun of people congregating at the beach.
Well, the beaches were very, very busy, and I would say 75% of people in Laguna were wearing masks walking around.
Yep.
And then, but COVID Island, that was not pretty.
Updates on the meteor that's supposed to hit us. It's not. It's like a 4% chance of hitting us the day before elections. Apparently.
People are wishing it'd be on the White House, right?
I mean, there's all kinds of crazy feelings flying around these days. Okay, I think that about wraps things up. Susan,
She
anything
was
else?
amazing, but
She always
don't-
is.
anything said on here is for educational purposes. It's not our belief system 100%. We're just giving people a place to.
Well, I just think it's important to have discourse and have different.
Yes.
Like she and I disagree on masks. Okay, she may be
Well-
right. I may be right. We'll find out. I think there's good evidence. She hasn't read that evidence yet. I'm going to send her the evidence. I trust her to read it, and then we'll see.
I don't be mad at us because you disagree with something somebody said.
Andrew, thank you on the Ethical Skeptic. I couldn't remember the name of the guy, so I'm going to go sign up for the Ethical Skeptic right now. Hold on, and how do I find? Oh, there we go.
So maybe we should talk about what's coming up.
Let's do it again. We have Dr. Yo on Thursday, right?
Well, tomorrow's Wednesday, honey. We should probably
And
talk
tomorrow
about that
we
first.
have Dr. Well, you just did that. I'm signed up with the Ethical Skeptic, Dr. David Samadi.
I didn't
He
put
is
the date on, so.
That's tomorrow. He is the surgeon that brought us the robot that we use for radical prostatectomies now. He
So
brought
we're going
us
to
the
talk
Da
about
Vinci.
prostate
Yeah,
cancer
so we're
and
gonna
take your
have
calls.
And I'm very involved in prostate cancer through the Prostate Cancer Foundation. So it's something I have prostate cancer.
And then also on Thursday, Dr. Yo's going to bring us 2 patients that lived through COVID, and they had very interesting stories.
Yeah, there's a lot I want to talk to Dr. Yo about. There's a lot of stuff kind of evolving here that he keeps very carefully keeps up on. And that Bradykinin story, I want him to sort of lay that in for us with the Ranty story.
And then also, don't forget to watch foxla.com live at 7 p.m. tonight.
Mm-hmm.
Drew and Alex are back, and he's here 4 nights this week, so that's good news.
Oh, it's not Alex tonight. It's actually Marla. Sorry about that. He's still on vacation, so.
Oh, okay, good. I'm glad he's taking a vacation.
Yeah.
He won't be in a couple weeks because it'll be sweeps. That guy works more than you do.
Thank you, Shannon. Julie, Miami, where there's strict indoor and outdoor mask policies for months, but continued to be the hot spot for the state for causes and death. Julie, maybe it's people pushing back on the state and not wearing their masks, seems to me. But you're right. This is the point. It's why I didn't want to get into a big argument with Dr. Kelly. We'll see. We'll see whether masks are good or not, or whether they're They're net negative. We know for sure that the shelter in place was net negative. There's no doubt about that now. Maybe we'll learn the same things about masks. I'm not sure. We'll see.
Somebody wants us to bring the Surfer Boys into the studio. I think we should too. That'd be
bring
fun.
'em, like right here, like
Chad and what's
they
the
live in, and JT.
JT?
They live in San Clemente, but if they want to come in, that'd be fine. All right, we're gonna wrap it up. I gotta go do that Fox 11 thing. I appreciate you guys being here. Oh my goodness, it's really late. We appreciate you guys joining us.
You guys talked a lot.
Well, mostly Kelly. I mean, she knows what she's talking about, and she can express it in great detail. I like
I
that.
know you had a lot to cover, and I appreciate you guys with all your great questions.
Yes, it was really good. A good chat thread there. And then tomorrow we'll have calls. Is that correct?
Yeah, we're gonna have calls tomorrow, and I'd like everybody to look at our new sponsor. It's
And by
Better
the
Life
way,
Recovery in Orange County. That's gonna be the outro. If you could take a look at it.
yeah, these guys are. We're lucky to have supporters that are really quite high quality. So we appreciate you supporting them. I'm by the way, because we're on the internet, I'm interested in reaching out to the globe, and if there are people out there in other countries, I know we've occasionally have some people from India and from England.
We had we had Africa today.
Yeah, ring in, get involved here. Let us. We want this to be kind of a global conversation, and I'd like to share some of the similarities and differences of what you guys are experiencing across the globe. And so you are welcome here. And I don't know if we need to translate things. I imagine Google can do it for me. So in whatever ways you want to bring it in to communicate, please do. We are
Does YouTube
very interested. I'm very
Translate
interested in
in
that.
different.
Does what?
Does YouTube translate or Facebook or something?
I'd have to copy it and
Like
put it over YouTube.
subtitles.
I can get it translated. Okay, everybody. We'll see you tomorrow. This time, Susan, is that correct?
3 p.m.
3 p.m. looking tomorrow.
Back.
Yeah, I got
Kayla will
another-
be here.
Tomorrow's a rough day. See you tomorrow.
Ciao.
According to SAMHSA's National Survey on Drug Use and Health, approximately 20.3 million people above the age 12 suffer from substance use disorder. Incredible. The disease of addiction takes an average of 130 Americans every day. Sadly, the opioid crisis, which many consider the worst pandemic of our time, has been even further perpetuated by the spread of COVID-19. Since the start of the coronavirus outbreak, drug overdoses have increased by 18%. Factors like economic stress and social isolation have led to increased depression and unnecessary deaths. A Better Life Recovery is a premier addiction treatment center in Southern California, offering one of the most highly regarded and comprehensive addiction treatment programs in the United States. Dedicated to helping its clients achieve complete inner and outer transformation, they offer a 45 to 90-day program custom tailored to meet the needs of each individual client. Long-term is the way to go. Many of A Better Life's clients elect to stay up to 9 months to receive additional support. A Better Life Recovery will do whatever it takes for as long as it takes to ensure the success of every client. Are you ready for a better life? Go to abetterliferecovery.com or call 866-581-4401 now.